statin, how much of LDL reduction you can achieve with statin, increasing statin. But certainly, if your patient is young enough to tolerate the maximum dosages, all the guidelines suggest that give maximum dosages of statin before adding on. But sometimes you're clear enough that even with maximum dosages of statin, not going to achieve targets. We'll see how adding of statin can decrease amount of your LDL levels, and how adding another agent, what amount or what percentage of LDL will be reduced with that. So you have to make out your target in that, that whether you're able to achieve that with maximum dose of statin. If not, then start early. And it's indicated that you have to start combination either ezetimibe, PCSK9 or bempedoic acid early in your patients with statin to reduce statin intolerance as well and achieve your target as early as possible. And we'll discuss that. So usually in these kind of patients, you have to think of combination therapy right from the beginning, where you think that your target are way beyond, the baseline is way beyond your target. Your patient is showing some evidence which may suggest that this patient may develop statin intolerance. These are the add-on drugs after maximum tolerated statin. We already have discussed. These three were always there. This icosapentaethyl, this is for triglyceride. Previously, people are adding on triglyceride patients even at like 200, 300 triglyceride, they add on fibrates along with statin, which is not indicated. It is indicated once it's above 500. Now it's 2B recommendation between 150 to 499 triglyceride. You can add on this drug to statin. So this is specific to triglyceride. Rest are to achieve LDL targets if you are not achieving with your maximum tolerated dose of statin. These are the existing drugs with different mode of actions, which we already know, that absorption, cholesterol synthesis by means of taking care of different pathways, that's LDL receptor, PCSK9. The newer one, inclisiran, a bit in a way that different, that it affects messenger RNA, and again act similar to like PCSK9 because it's used less frequently, like once in a 6 month and then subsequently once a year. So more feasible as compared to PCSK9, but we are predominantly discussing today the bempedoic acid, which is ATP citrate lysase inhibitor. So it inhibits that same pathway where statin is acting, few steps ahead of that pathway. So, and it acts directly into the liver, no muscle action, so less frequent muscle side effects. Do have some side effects like uric acid increase and other indigestion and other, but not a major, and evidence have shown that it's tolerable and can be given to your patient along with statin. It was first approved by FDA in 2020, usually for heterozygous familial hypercholesterolemia, for those patients with ACVD who require additional LDL-C lowering. It's already being approved there, then used in different trials, especially the last one, clear outcome, which has shown reduction of enormous amount, like 15-16% reduction of LDL in patients who are intolerant to statin, with benefits as well as compared to placebo. And this is a very important 2-3 slides I'm remaining with, and then I'll end the presentation. It will be open for question answer and expert comment. That's a trial showing add-on statin, how much of LDL reduction you can achieve after increasing your dose of statin from even low to moderate dosages. And they really worked on every, like Rosuva, Torva, Simba, and Pravastatin. Very interesting results. That doubling of statin dose were associated with lowering of LDL by just 4 to 6%. So if you're adding from 10 to 20 Rizuva, you expect 4 to 6 or maximum 6 to 7% further reduction of LDL. So that's very important point to remember when you are taking your patient into consideration for treatment of dyslipidemia for achieving target, that how much of LDL reduction you can achieve with your maximum dosages of statin. Sorry, here you see after 10 milligram, like this one Rizuva, 10 to 20, 20 to 40, the further reduction जो आ रही है आपके इस moderate dosages के बाद उसमें गौर करें कि hardly like 5 to 7% की reduction है further dose increase करने पे. Same applies to atorva. From baseline to atorva 10 milligram, you have reduction of that much, like 35%. But from there, 10 to 20, it's just like 37 to 40 to 43 to almost like 5 to 7%. And same applies to all. So your initial moderate dose is the maximum reduction of LDL you can get with your statin. And subsequent increasing dose just reduce LDL by 5 to 7%. That's the total you can get with your increasing dosages of statin. So that's